Bismillahirrahmanirrahim. As we have studied a lecture series on endocrinology medicine, first of all, we should know about anatomy of normal anatomy and physiology of the thyroid gland. So let's come. Thyroid gland is one of the largest gland among the endocrine glands. Okay. Where is it located? It is located below the larynx and anterior to the upper part of the trachea. Anterior means and front side to the trachea. It is located front side to the in front of trachea. It weighs about 15 to 20 grams. Thyroid gland has two lobes connected by a narrow band thyroid tissue called isthmus. This is isthmus, okay? This is isthmus, narrow band tissues, okay? This is one lobe, this is another lobe, okay? And connected by isthmus. Isthmus overlies second to fourth tracheal cartilage. Okay. Now let's come to the histology of the thyroid gland little bit. When you see macroscopically thyroid gland containing many hollow structures called follicles. Many hollow structures called follicles. These are follicles, okay? In these follicles, there is main thing lies inside this. This is called colloid. Colloid is a thicky substance and it contains a major constituent of the large amount of glycoprotein, and this glycoprotein is thyroglobulin. Okay, thyroid gland stores T3 and T4 hormones whenever the body is needed. We have discussed the thyroid gland. Now let's come to the again anatomy and physiology of the thyroid gland. As I have discussed, thyroid gland is one of the largest gland among the endocrine glands. It is located below the larynx and it is anterior to the trachea. It weighs about 15 to 20 grams. It has two lateral lobes connected by a narrow band tissue called isthmus. Isthmus overlies second and fourth tracheal cartilage. And thyroid gland posteriorly, back side of the thyroid gland, 4 tiny parathyroid glands. Posteriorly, thyroid gland posteriorly, 4 tiny parathyroid glands which secrete parathyroid hormone which maintain the blood calcium level. How? Whenever the blood is needed a calcium, so it suck from the bones, kidneys and intestine. Thyroid gland hormones. Thyroid gland secretes 3 hormones. One is triiodothyronine T3. Second one is tetraiodothyronine T4. This is also called thyroxine T4. And the third one is calcitonin, which lower the calcium level in the blood. When there is a rise calcium level in the blood, so it lower the calcium level in the blood. It lower the calcium level in the blood. Calcitonin. So what is the function of T3 and T4? There are so many functions of T3 and T4 hormones. It maintains weight, endocrine level, all metabolic activities controlled by this. Internal temperature, skin, hair growth, nail growth. These are all things controlled by the T3 and T4 hormones. Thank you very much. Today we have discussed about thyroid gland, anatomy and physiology. As I have discussed, thyroid gland has two lobes, two lateral lobes connected by uh, what? Isthmus. Isthmus. What is isthmus? It overlies second and fourth tracheal cartilage. Okay, these are cartilage, the trachea cartilage. Okay, it overlies in second and fourth tracheal cartilage. Thyroid gland posteriorly there are situated some glands, four tiny glands, which are called parathyroid gland, which secrete parathyroid hormone, which maintain the calcium level in the blood. Okay, as we have discussed thyroid gland, what is the function of thyroid? Thyroid gland basically composed of histologically composed of follicles. This is a functional unit of the thyroid gland, follicles, in which collide. What is collide? It is containing. It contains a protein called large glycoprotein, which called thyroglobulin. Thyroid follicle also store hormones whenever the body is needed. And thyroid gland secretes three types of hormones. Number one is T3, number two is T4, number three is calcitonin. T3 and T4 function. What is the function of these? There are so many functions of these, but few of them I have written here. Weight maintaining, energy level maintenance, internal temperature maintenance, skin and hair growth maintenance. These are all functions of the T3 and T4. Thank you very much. Next lecture will be uploaded on the lecture series of the endocrine medicines, inshallah ta'ala.